Hi, this is Ed O'Brien, and I will be doing my presentation on opioid addiction in nursing. The incidence of substance abuse in nurses is similar to that of the general population. But nurses are more likely to abuse prescription medications like opioids than the general public. It is estimated that between 10 and 15% of nurses are impaired or recovering from substance abuse. This is a quote from drugrehab.com about nurses and addiction, which gives a nice introduction to the topic, but also reinforces that it is a real problem. Nurses are often the first to treat and the last to care for patients. Many of the profession deal with stress, fatigue, and personal problems by turning to drugs and alcohol. Numerous substance abuse programs and treatment options exist to help them overcome addiction. The learning objectives for this presentation are stated here. By the end of the presentation, the student will be able to state 3 potential contributing factors for opioid addiction in nursing, be able to name 4 physical signs of potential opioid abuse in nurses, and be able to list 3 of the practice areas where opioid abuse is highest in nursing. So what are opioids? Opioids are a class of drugs that block pain receptors in the brain. They also cause a sensation of euphoria when taking. Because of this, regular use may lead to tolerance, dependence, and addiction. Examples of prescription opioids are hydrocodone, oxycodone, and fentanyl. Another example is the illegal drug heroin. There are contributing factors that may increase the risk of opioid abuse in nurses, like job-related stress, easy access to medications, physical exhaustion, coexisting conditions like depression or post-traumatic stress disorder, mental or emotional exhaustion, burnout, and insomnia. Nurses may self-medicate to relieve some of these factors, which can lead to substance abuse. There are certain practice areas in nursing that have a higher incidence of opioid abuse in nurses, and this is likely related to the fact that they are high-stress areas where a lot of opioid medication is administered. Nurse anesthetists are at the highest risk, with nurses in critical care areas, the emergency department, oncology, and psychiatry also being at high risk. Signs of opioid abuse can be changes in work performance, changes in appearance, or changes in behavior. Examples include reduced job performance, irritability or mood swings, tardiness and absenteeism, tremors, shakiness, a disheveled appearance, frequent discrepancies in narcotic counts or waste, or frequently volunteering to administer pain medication to patients. Other examples include trouble focusing or being distracted, forgetfulness, frequent use of the bathroom, acting isolated or secretive, and inadequate pain relief reported by patients under the care of the nurse. However, it should be kept in mind that these signs are very generalized and do not prove opioid addiction is present. There are consequences to opioid addiction in nurses, and its impact can be felt on multiple levels. Opioid abuse places the individual nurse at risk. The nurse may feel guilt and shame over their addiction and may not seek help or treatment. They are at risk of disciplinary action, termination of employment, and suspension or loss of their nursing license. They could also be faced with criminal charges and incarceration. Opioid abuse can affect health insurance coverage, ability to get treatment, and cause loss of livelihood. The impaired nurse is also at risk of physically harming themselves through overdosing or contracting bloodborne infections if injecting opioids and using high-risk behaviors. Opioid abuse also has negative consequences for the nurse's colleagues and employer. An impaired nurse is likely not working to potential and may increase the workload for other nurses they work with. Tardiness and absenteeism would also affect coworkers and the institution. If the nurse is suspended or terminated, this could initially affect staffing and morale. The reputation of the institution may also be affected if an employed nurse is charged with opioid diversion and abuse. Opioid addiction in nurses has a negative impact on the nursing profession. Nursing care is not delivered per the standard of care when opioids are being diverted or the nurse is practicing in an impaired state. There is also the risk of developing mistrust of the nursing profession when there are reports of opioid abuse in nurses. State nursing boards cite substance and alcohol abuse as the #1 reason for disciplinary action. Opioid addiction in nurses also has negative impacts to healthcare and society. First and foremost, patient safety can be compromised. Not only can patients experience inadequate pain control as a result of opioid diversion, Patient injury and even death can occur as a result of an impaired nurse caring for patients. Impaired nurses can have poor judgment, slow response time, make mistakes, and neglect patients. There are also billions of dollars in costs to the healthcare system and society as a result of diverted opioids, non-productive work hours, the cost of treatment for addiction, and associated costs of discipline and legal action. Most healthcare facilities are reluctant to report opioid and other substance abuse for fear of liability or tarnishing the reputation. Underreporting by healthcare facilities exacerbates the problem. If employers choose to terminate a nurse instead of offering treatment, the impaired nurse may find employment elsewhere and continue to abuse opioids. As opposed to disciplinary processes, alternative to discipline or ATD programs support addiction treatment while refraining from practice and support recovery and return to nursing practice, which can have a positive impact on society as well as the profession. Substance abuse is as common in nursing professionals as the general public, but nurses are more likely to abuse prescription medication, including opioids. Job-related factors may contribute to opioid abuse and addiction in nursing practice. There is an increased incidence of opioid addiction in high-stress nursing practice and where opioids are commonly administered. Opioid addiction in nurses can have a negative impact on the nurse, his or her colleagues, patients, the public, and the healthcare system. Thanks for listening. These are the references I used for my presentation.